Welcome, everyone. I hope you can all hear me. We are so glad you would join us today for our Strolling Thunder, our Think Babies Advocacy Day for 2020. I'm Michelle Ribas, the Policy Director at the North Carolina Early Education Coalition. It's my honor to kick off today's event and showcase the work of the Think Babies North Carolina Alliance. We are a proud partner in the National 0 to 3 Think Babies campaign and in the Pritzker Children's Initiative, National Collaboration for Infants and Toddlers. I want to welcome all of you today for joining us for Strolling Thunder, where we can all be a big voice for babies. We want to encourage policymakers at the national and state levels to think babies and make their potential our top priority. I want to especially thank Moms Rising and the North Carolina Association for the Early Education of Children for being our co-sponsors today. And a special thanks also to Lucia Planchin for providing Spanish interpretation. Bienvenidos. Click the global icon at the bottom of your screen and select Spanish if you need it in that language. I'm so glad to see so many of our Think Babies leadership team with us today, our Think Babies community partners across the states, and so many baby advocates joining us today. I wish we could be together in person to meet and greet each other, but for Zoom land, let's make sure we introduce ourselves to each other in the chat. So why do we want to put a spotlight on what all babies and families need to thrive? It's simple. The science is clear. Our brains grow faster between the ages of 0 and 3 than at any later point in our lives. Ensuring that babies have healthy beginnings, supported families, and access to high quality early care and learning has an enormous impact on how a child learns and grows throughout his or her lifetime. Think Babies NC is laser focused on promoting public awareness and policy solutions that promote the healthy development and learning for infants, toddlers, and families in North Carolina. We want North Carolina state legislators and our members in Congress to hear that it's time to think babies and to hear this message from all of you and from some of their youngest constituents. We've had young children on these calls with policymakers before. So let them know it's time to take more than baby steps and to make sure that babies and the families are the top priority. Well, we have an exciting, jam-packed agenda for you today. In the next hour, you'll hear from Dr. Kimberly Montez, leading researcher in the field of maternal and child health. We've got an exciting panel with our own Think Babies leadership members on our policy priorities. We're going to have a dance party with DJ Pitty Pat. You'll hear from Elaine some advocacy tips on how to be a big voice for babies. And we'll have a story time with the author Megan Bryant reading Citizen Baby, My Vote. And we'll kick off the day of action. So before we go any further, we're going to hear from a few of you about why you think babies.
My life depends on it. We need to educate young children now to prepare them to lead this country. Thank you. Think Babies.
It's important to take care of babies to make them feel loved and make them feel happy and safe and play with them and let them know that they're very important to everyone.
Hello, my name is Daryl Smith, and I think babies because babies are the future, and they are able to bring everyone together at any time because they are a joy and peace to the world.
Well, that was just so incredible to hear from you. We thank all of you for sending in your videos and photos that we'll be sharing throughout today's event. It's now my pleasure to introduce Dr. Kimberly Montez. Dr. Montez is an academic and a general pediatrician in Winston-Salem. She's an educator, a researcher, an advocate, and as she said, a mother of a strong-willed 2-year-old girl. Well, what 2-year-old isn't? She's vice chair of the Council on Community Pediatrics with the American Academy of Pediatrics and a member of the North Carolina Pediatric Society. She's also a member of Moms Rising and a powerful voice for what our youngest children and their families need. She's joining us now on a pre-recorded video to talk about how COVID-19 and how the underlying racial disparities are impacting babies' health and well-being, and what policy changes are needed to support them in having the best possible start in life. Please welcome Dr. Montez.
Hello, I'm Dr. Kimberly Montez, a general pediatrician in Winston-Salem and member of the North Carolina Pediatric Society, the state chapter of the American Academy of Pediatrics. To the organizers, thank you so much for inviting me to speak, and to the attendees, thank you for raising your voice on behalf of children and their families. Today, I want to share with you why it's important to support policies that promote healthy beginnings for all babies, children, and families. Before the pandemic, children I care for were already facing significant health disparities due to persistent structural racism and discrimination. The COVID-19 pandemic has put dire financial strain and stress on families, especially families of color who have been disproportionately impacted by coronavirus infections, job losses, school and childcare closures, and lack of paid leave. A single mom, who I will call Rosa, of one of my patients who lost her job because of the pandemic, recently told me that she often goes hungry so that her children will have enough to eat. Her food stamps, otherwise known as the Supplemental Nutrition Assistance Program, or SNAP, last less than 2 weeks. She can't afford to look for another job because she has children to take care of at home and can't afford childcare. Unfortunately, stories like Rosa's are all too common. In North Carolina, 1 in 5 children lived in households with food insecurity before the pandemic. And now, a recent nationally representative survey showed that more than 1 in 3 children live in households with food insecurity. Families that scraped by before the pandemic are finding themselves frequently visiting food pantries and food banks, often overwhelming the capacity of the charitable food system. While the food system faced challenges before the pandemic, often due to long-standing racial inequities, novel complications have bubbled to the surface. According to Feeding America, 41% of food banks in early April were already reporting a critical shortfall in funding due to the surge in need. Unfortunately, the charitable food system is still important and necessary for some to feed their families, but the current crisis has widened the hunger gap with shortages of donated food and volunteer workers. Decades of research has documented the adverse health effects of food security on the health, growth, development, and educational outcomes of children from infancy through adolescence. Good nutrition is essential to health, and good health is essential to effective learning. SNAP is a federal nutrition program for low-income families that is known to reduce poverty, improve the economy, improve food insecurity, and encourage healthier eating. However, the monthly benefit for the average SNAP recipient is a mere $127 per month, and 80% of SNAP benefits are spent within 2 weeks of receipt, leaving many children hungry by the end of the month, like Rosa's family. Now, with rising food prices and job losses, increasing the maximum SNAP benefit is more critical than ever and is key to reducing the number of children and families who are not getting enough to eat each day. Now that many children are attending school remotely, the nearly 22 million low-income children who participate in the National School Breakfast and Lunch Program and after-school meal programs have since lost 2 to 3 meals per day with school closures. In addition to making SNAP stronger, passage of the Pandemic Child Hunger Prevention Act would provide universal free meals during the 2020-2021 school year and could help school nutrition program finances as they recover from the losses from the pandemic and mitigate the time and resources needed to process new applications. The American Academy of Pediatrics is calling for the bill's swift passage. Before the pandemic, low-income families struggled with accessing safe, high-quality, affordable childcare like the single mom I mentioned earlier, Rosa. We know that high-quality childcare is critically important to early learning, child development, and the health and safety of our communities. Unfortunately, the pandemic has made it clear how undervalued caregiving is, especially when it comes to childcare programs. Disproportionate caregiving burdens fall on women, limiting us from labor force participation and advancement and forcing our families to forego much needed income that could help promote increased safety and security, particularly during these uncertain times. Childcare is essential as it ensures parents and caregivers, especially women, can work and support our families while providing children with a strong foundation for future success. There is no economic recovery without childcare. The COVID-19 pandemic has shown how critical childcare is to our society's infrastructure, but many providers and centers could go under without immediate action and funding. An estimated 4.5 million care spots may be permanently lost because of COVID-19 closures. We can't allow Act a national paid family and medical leave program. The United States is the only high wealth country that fails to guarantee any kind of paid leave to workers. Because no national paid leave program currently exists, families are forced to make difficult choices between work and care, resulting in lost wages for unpaid family caregivers and propagating income, wealth, and health disparities across gender, race, and ethnicity, which have only worsened with the pandemic. On the basis of statistics before the current pandemic, of those who needed leave but did not take it, 64% were women. For the women who take leave after giving birth, nearly 1 in 4 return to work within 10 days. I was one of those women, even though I had a premature daughter in the neonatal intensive care unit. Maybe you were one of those moms too. For new mothers, a lack of access to paid family leave poses substantial health risks. 1 in 5 women are at risk for developing postpartum depression within the first year after childbirth. Alarmingly, maternal suicide in the first year post-delivery encompasses 20% of mortalities for all women. Several studies have highlighted the positive impact on postpartum depression, breastfeeding rates, intimate partner violence rates, and overall physical health for new mothers who take paid leave. From a race and ethnicity perspective, families of color are disproportionately susceptible to the economic consequences of personal or family medical problems, which lack of paid leave exacerbates. Only 23% of Latinx workers and 41% of Black workers report having any type of paid leave to use for serious medical or family needs, including paid parental leave. The rate of preterm birth and having a low birth weight infant among Black women is 14% and 13% respectively, compared with 9 and 7% respectively among white women. Adding to these disparities, the infant mortality rate is 5.8 deaths per 1,000 live births for white babies, while it's 11.4 for non-Latinx Black infants. These appalling statistics make the United States 33rd of the 36 member countries of the Organization for Economic Cooperation and Development for infant mortality rates. Compelling evidence illustrates that 10 weeks of maternity leave reduces infant mortality at a rate of 1 to 2%, whereas 30 weeks of maternity leave reduces infant mortality by 7 to 9%. Positive effects of paid parental leave on rates of preterm births, low birth weight infants, and infant mortality rates would help close these racial and ethnic gaps, reduce healthcare costs, and benefit the economy. Lastly, access to healthcare is critically important now more than ever. Before the pandemic, hundreds of thousands of hardworking, low-income people in North Carolina were uninsured. Now, in the middle of a pandemic, many are losing jobs and health insurance, with some estimates reaching more than 475,000 adults, not to mention their family members who were covered under their policies. The health of parents and their children are interconnected. Children whose parents have health insurance themselves are more likely to take their children to their regular checkups with the pediatrician. Many child health indicators, such as the infant mortality rate, will continue to lag behind until parents can get health coverage too. For example, many infant deaths could be prevented by basic health care for mothers. Unfortunately, the cost of care keeps many women from receiving health care before they become pregnant and during the critical first trimester of fetal brain development. The high cost of healthcare is a problem for all of us. Keeping so many people uninsured drives up costs. Medicaid expansion has the opportunity to not only provide access to care important for the public's health, but also local tax revenue and jobs creation. In the 39 states that have expanded Medicaid, the cost of private insurance has decreased because ensuring people receive preventive healthcare is significantly less expensive than treating them in the emergency room when health problems become life-threatening. To improve the health of both children and adults, North Carolina must utilize available federal funding to expand access to health insurance for North Carolinians. Investing in the health of parents and their children is both the economically and morally wise path for North Carolina. Now is the time to raise our voices to demand a just economic recovery, adequate funding for programs that promote healthy beginnings for children, and robust measures to ensure a future where our children and their families receive adequate nutrition, quality health care and childcare, and access to paid leave. Thank you so much.
Wow. That was such an important message from Dr. Montez. We so appreciate her being with us today, for sharing her voice, her wisdom, her expertise. We will have her video posted on our Think Babies website in the near future. So we hope you'll share it, share her message, and take action. Next, I am so excited to introduce our Think Babies North Carolina Alliance and our top policy priorities. Our Think Babies NC Alliance includes over 40 members and 20 different state, regional, and local early childhood organizations, including the Governor's Office and the North Carolina Department of Health and Human Services. What a power team. And across the state, we have dozens of Think Babies community partners. We have thousands of baby advocates working together to promote public awareness and policy solutions to make sure every baby has what they need to thrive. Just 3 things to keep in mind: healthy beginnings, supported families, and early learning opportunities. Today and every day, we urge our state and national leaders to focus on our youngest and most valuable resource by investing in programs that work. We're known for programs that work in North Carolina. We know that increasing funding for childcare assistance would allow more families to work and make sure babies receive high-quality early learning experiences. Strengthening the early childhood workforce with better educational preparation and increased compensation would make sure babies have teachers that can support their healthy development and learning and their own children and families. Expanding home visiting and parenting education programs would provide critical support for families during a time when every family is most stretched in their new parenting role. Closing the health insurance gap would help ensure healthy births, reduce infant mortality, and promote on-track development for our kids. Providing workplace accommodations for pregnant mothers and offering paid family leave would make sure that parents and their babies are healthy right from the start. And making sure every child counts. In this time of completing the census so that every child will count, please be sure you do your application if you haven't already, and encourage others. We want every child to count in North Carolina. So these are the kinds of policies we believe need to be in place for babies and their families. This is what Think Babies is all about. All of us working together to push these policies for babies forward. It's my honor to have 3 of our work group chairs with us today to talk about the Think Babies policy agenda. I'm going to introduce them to you now. Sharon Hirsch is the president and CEO of Prevent Child Abuse North Carolina. Sharon Hirsch is our co-chair of the Supported Families Work Group. Next, you'll hear from Sharon Loza, president of the North Carolina Infant Early Childhood Mental Health Association, and also the Early Intervention Branch leader at DHHS. Sharon is the chair of the Healthy Beginnings Work Group. And also from Teresa Rodesheimer. Teresa is the infant infant toddler policy leader at the North Carolina Division of Child Development and Early Education. Teresa co-chairs our early learning work group. So I welcome them all here today. I'll bring their voices in now. And first, I want to ask each of the work group chairs to tell us about the Think Babies priorities in their area. What are the top priorities for Think Babies and why are these so important? So Sharon Hirsch, let's start with supported families.
Thank you, Michelle. We know parenting is the most challenging job you'll ever love, and that all parents need help and support, especially in the early years. And that's why we've prioritized increased access to home visiting and parenting education and paid family and medical leave. Home visiting and parenting education programs build parents' knowledge and skills in child development. These are really important to building strong families, enhancing maternal, physical, and mental health, and reducing the risk of child maltreatment. Paid family and medical leave is important because it reduces family economic stress, reduces infant mortality, and provides greater opportunities for parent-child bonding, because we know that those early connections matter for babies' brain development. And you heard so much from Dr. Montez about why we need to invest in paid family and medical leave. Thank you.
Thank you, Sharon. And now we're going to turn to our other Sharon, Sharon Loza. Sharon, can you talk to us about the top priorities for Healthy Babies work group?
Yes, thank you. And thank you for the opportunity to be here. Good morning, everyone. I'm speaking on behalf of the wonderful work group that's focused on healthy beginnings. And we've had two key priorities for the Think Babies work for last year that are carrying on. And that is to close the health insurance coverage gap. And what that is to expand Medicaid, as well as ensuring that we have expanded insurance coverage for families. We know this was an issue in North Carolina before COVID, where we had at the minimum 100,000 parents who fall into this. But with COVID, we know with increasing unemployment that the risk of losing insurance is even more dire for our families. This is important so children and families get the best care that they can to have the healthiest start. We know that those foundations that begin even before a baby joins us are critical to healthy babies being born, and healthy babies need healthy mothers. So ensuring families have that insurance is critical to getting children off on the best start in life, as well as ensuring helping support economic supports for families so they aren't at risk for even more economic risk without insurance. Another key priority is to ensure that there are workplace accommodations for pregnant women. We know that the workforce is growing and continues to grow, and to ensure that women have appropriate workplace accommodations is necessary, again, for their health and well-being, as well as that for their infant that's born. In addition to that, there's ample research to show that by providing those accommodations, rather than thinking of turning over your workforce of women, that there are actually economic benefits to businesses as well. So we find these as two key priorities of many for the Healthy Beginnings work group.
Thank you, Sharon. So hard to summarize these things in a couple minutes, but we're giving the high points to you all today. So I want to bring in Teresa Rodesheimer. Teresa, tell us what's happening in the early learning work group. What are your priorities?
Good morning, and thank you all for being here, and thank you for having me today. I truly enjoy co-chairing with Marcia Baslow with this early learning group, just such a wonderful group to work with. And while we were working on these priorities, we made sure that we established some overreaching goals. And the first one is to work to stabilize and rebuild, stabilize the workforce and rebuild childcare programs. Which, have nationwide been seeing a decrease in numbers. Continually assess the effect of COVID in early childhood education arena, and develop strategies, policies, and possible funding to address these issues. And last but not least, to ensure to apply a racial equity lens to all of our work. And that being said, the early learning priorities are to, one, ensure that infant toddler teachers are well qualified and well compensated. work to revise childcare subsidy policy to increase equity of access for all infant and toddlers. And lastly, to expand the supply of high quality infant toddler spaces across the state, particularly in childcare desert areas or areas of limited care. To do this by leveraging state, federal, and private funding. And I think that my other leads, really talked about the why, and all of our work just goes together so well. And brain science, tells you, of course, that the first 3 years are so important, and that's why we have chose these different areas to work on.
Thank you, Teresa. We're going to do another round with the panel, and this time talk about the impact of COVID-19, because we're still living with it. It's going to be with us for a while. It has upended much of the work we've done, changed how we do our work in many ways, but it really has put a spotlight on what matters most to support babies and their families. So what are some of the areas we need to focus on now? And what new issues might we see coming forward from the Think Babies teams in the near future? So let's go back to Sharon Hirsch again. Sharon, tell us about what Supported Families is seeing under COVID.
Thank you, Michelle. There's a lot that's been happening with COVID, particularly for families that have been trying to access home visiting and parenting education. It's been really difficult because we're all so socially isolated in those programs. It's very difficult for home visitors to go visit at families' homes, and parenting education programs were usually offered in group settings. So a new issue for us that we've never had to really deal with before is broadband access, because so many of these programs are now being offered remotely. And the systems of support for those programs as well also need access to the support virtually, and need a lot of advice and counseling on how to use those virtual platforms like we're using right now on Zoom. So that's been a really big change. We've also seen so much greater economic stress, and it's kind of taken the onion is being peeled back even further in helping us all understand the critical importance of our safety net programs and economic supports for families. We anticipate a greater emphasis on the need for economic supports, particularly unemployment insurance and paid sick days, in addition to paid family and medical leave. All of these are examples of things that families need to reduce their economic stress. It is such a critical piece for our babies to have parents that aren't dealing with that stress every day, particularly because it places them at risk of child maltreatment. We're going to continue to fight for this. And as I finish my comments, I particularly want to thank Crystal Kelly, who's the co-chair of the Supported Families Work Group, and all of the folks that are on our work group who are helping us figure out how to prioritize all of these incredible needs for families right now.
Thank you, Sharon. You can see our agenda is just getting bigger and bigger and more integrated in so many ways, and raising up some new issues like broadband technology. I never even did Zoom before COVID. Now I do it 4 or 5 times a day. So
exactly,
raising that up, and the challenges are so important. So Sharon Loza, what have you seen under COVID in the health arena for kids and families? Where are our attention now?
Thank you for that. And actually, I'm going to expand on Sharon Hirsch's, because I think one of the things we're finding, especially related to COVID, that's also related to another key priority of us is expanding Medicaid, expanding health insurance, as well as what's included for families. One of the things that we're learning is that Medicaid for now has provided some flexibilities, as well as private insurers, around telehealth and affording that opportunity that didn't exist before, so that way families can have continuity of care. This is a priority moving forward, because it was on the radar and the agenda before, because we knew by affording families telehealth, we could potentially reach farther in areas that didn't have specialized services or health services. But in addition to that, it's been instrumental in ensuring that families get some level of continuity of care during this time of COVID. And so this one dovetails and kind of marries with what Sharon Hirsch said as far as broadband, because to be able to expand telehealth and maintain that as a policy, priority within insurance, you also need to be able to provide that broadband for the really far reaches of the state that may not yet have infrastructure. So that's one key impact we found with COVID, and one opportunity for us as a state to keep moving forward, to advocate and to keep some of the flexibilities that have been afforded, to keep them in place, because they will still have a place when we resume face-to-face. Some initial survey results I've heard from different parts of the system or colleagues is that in looking at the impact of teletherapy and what it's afforded families, is that many families would like to have this option moving forward. And so this is something we can definitely advocate for. In addition to that, like Sharon mentioned, I think another opportunity for us and policy priority we can pursue is expanding early intervention services for families. We know that those first 3 years, as Teresa and Sharon have both highlighted, are critical for families and infants alike, for their brain development, for their architecture, and setting a sound foundation. And we also know that children with disabilities and families who have children with disabilities are multiplied with some of those stressors, because you're trying to understand how you best help support your child who may be at risk or have disabilities, and ensuring that there's more opportunity for those families. In addition to that, expanding Part C or early intervention services, if we had expanded eligibility, could be looking at families who are dealing with those stressors and incorporating more early childhood mental health supports, and to provide that for supports and services that families and young children need, again, in these first 3 years of life. So many opportunities, those are just two to highlight, but appreciate the opportunity to share that. And again, echoing Sharon's and Teresa, just the work group has been so instrumental in helping already make some pathways forward with this, but to continue to grow our efforts in support of these priorities. Thank you.
Thank you, Sharon. Highlighting the importance of starting early, working on the prevention side of things. We know families are under more stress, so we need to work at the front end more than ever. So Teresa, I want to turn to you now. Certainly we know COVID-19 has devastated the childcare industry. What are you seeing in the early learning area, and where should we begin to focus our attention now?
Absolutely agree with you, Michelle. This pandemic has shed more light on the fact that our childcare workforce is in critical need of support. Dr. Montez put it beautifully in her keynote, and she said early education is an essential profession. Many of us in this field have already known that, but this is the time now that we build upon that notion and that understanding. The workforce must, and I put that in caps, must be treated as the professionals that they are. One of the key areas that has to be addressed is compensation for the workforce. The need is reflected as a priority, not only for Think Babies, but also for many early education partners across North Carolina.
Thank you. That's right. Childcare is essential, and there are no more essential people in childcare than the teachers and staff that do this hard work every day now while they're risking their own health. So thank you, Teresa, for putting a spotlight on that issue. We are out of time for this part of the program, so I'm not going to be able to take last comments, but I invite the panelists to put their last thoughts or next thoughts in the chat, and to invite all of you to do that as well. Let's keep this conversation going. To learn more about the work of Think Babies, please visit our Think Babies page at the Coalition website. Take the Think Babies pledge, and we'll add you to our network if you're not already a part of it. So let's turn back to the world out there and people from the field. Let's have another video from one of our Think Babies advocates.
Babies because I believe it's the best way to close the opportunity gap.
Thinking about the babies that are being born today, the ones that were born yesterday, the ones that are going to be born tomorrow, and making sure that we give them every possible opportunity to grow and develop, to be the best person they can be, and to help their parents to work, to care for them, to have every possible need taken care of is just so important. These babies that we see today, they are our future. They are who's going to take care of us as we enter retirement. It's those babies that will be making decisions for our world in the future. And without proper care, without proper love, without giving the opportunities that we all want every single child to have, the future could look bleak. We need to be looking out for our babies.
Well, that was so inspiring. More words from our awesome baby advocates. Thank you all for sharing with us why you think babies. Continue to put your reasons in the chat box. We love seeing that and just knowing why all of you are here today. I'm Elaine Zuckerman. I'm the Advocacy and Communications Director with the North Carolina Early Education Coalition. So excited to have you all here to rally with us, even if it's virtual. We're having so much fun and we hope that you are too. And with that in mind, we are going to do something totally different now and ask you to make sure your camera's on, get up, get excited, and do some dancing. So joining us now from Durham is DJ Pitty Pat, and she is going to get the children here, children of all ages, up and moving. So DJ, take it away.
Okay, let me follow your instructions here. Let's see. 1 second. Click on share screen. Okay. Wait a minute. I'm not sure if I'm doing this right. You can still see and hear me, right?
Yep.
Okay, cool. I think I'll just start the music because I can't follow directions adequately. Let me know if this doesn't work, but I'm sure it'll work. Okay, let me see here. So let me see. Okay, are you seeing me or my playlist? Are you seeing me?
We see you.
Oh, good. Okay.
Hopefully you can see us, and I hope to see everybody dancing here in a minute.
All righty. Well, I'm not really good at dancing, so I thought I would have my friend Bunny Flailing Arms. Hurry up! Let's start the music. We only have a couple of minutes. Everybody dance!
One more song.
Thank you, everybody.
Wow, thank you, Pat, so much for that dance break. That was so much fun. I'm so impressed. You all have some serious moves here. Who knew? So thank you for joining. I hope that made this Zoom meeting a little more fun than the other 5 you probably have to go to later today. Pat, if you want to put the link for your website in the chat, that would be awesome. And I'm sure everyone would love to check you out more. So we're gonna hear from just a few more of you really quick with one more video to tell us why you think babies.
Hi, I'm Essence Walker, and I'm an infant teacher at Leaf Spring School, Charlotte. I think baby because I'm helping to develop tomorrow's future by providing high quality care.
I think babies because research has proven that an infant's brain develops by 90% between the ages of 6 weeks and 3 years of age. So yes, I think babies, I support babies. I am a mother of 4, and the true investment is early on. Thank you.
Is it important to take care of babies?
It's very important because they need, love, and they need attention to be able to grow and just become wonderful toddlers, children, teenagers, adults. They just need that in their life to be able to be the best person that they can be.
Thank you all again for sharing with us your reasons for why you think babies. So now I know we're running a little late on time, so we're going to go through this quickly, but we just want to give you some tips that you can use about how to be a big voice for babies. As you've heard already today, it has never been more important to lift up the needs of our youngest children and families. Children and families in North Carolina and across the country are facing huge challenges, especially right now due to COVID-19. So babies need you to be their champion, always, but especially right now. Just by being here today, you are helping to raise awareness of what babies need. But I'm going to guess that a lot of you have already taken steps beyond that too. So you're going to see a poll pop up here on your screen.
What?
So Angela, if you can launch the poll, and then we'll take just, 10, 20 seconds and let us know what advocacy you've done before. All right, we go ahead and close it out just because we're low on time, Angela. All right, well, I can see that you all are amazing advocates. You have done so much powerful advocacy work already, just this group of people right here. So now imagine if we could get everyone in North Carolina to speak up for babies. It's up to all of us to be a voice for our state's youngest citizens, to make sure that they have a strong foundation for success and one that is not undermined by the effects of this pandemic. And you, as advocates, have the power to make that happen. Elected officials want to hear from their constituents. They want to represent the best interests of their districts, but hardly any of them have a background in the things that matter to young kids. So childcare, family support, children's health. A lot of them don't even have young kids anymore. They don't even have young grandchildren necessarily to help them have that personal perspective. So your job right now is to help legislators understand the sheer urgency of this crisis and explain to them what is happening on the ground and in your own family and in your community. And the best way that you can do that is by sharing your story. So I'm just going to talk really quickly about why sharing your story is so important. Sharing your story about how this is impacting you is really the single most important thing you can do. So this crisis is big. That means we have to think bigger. We have to do more than what we've always done. So what you see here on the screen is what we like to call the surround sound approach. So just think about all the different ways that you can get your message across. So sending an email to a legislator is great, but what if you also picked up the phone and made a quick call? And then send an email to your colleagues or other parents that you know and ask them to do it too. Instead of just posting a message or a link on social media, what if you recorded a quick video like the ones that you've seen here this morning? Post it on your Facebook or on Twitter and tag your legislators too. So I just want to encourage you to think about all the different ways that you can make contact with policymakers and with your own network so that your message is more likely to be heard and shared. And especially in this virtual world we all live in, where we can't take you all down to Raleigh with us to meet with your legislators in person like we've done the last few years, it's even more important to get creative and think of new ways to reach them. So one example that we wanted to share with you is a quick video of a mom from Raleigh. Her name is Delonda Dixon, and she is incredible. And so we're going to just share her talking about her own personal story and what it means to her to have childcare assistance.
Everybody just needs an equal chance, with childcare. And the ones having to go through a struggle like me, who sometimes may have been worse than I am, who can't have childcare, I get emotional thinking about it. Because of my Head Start families, I think about excuse me, some that are homeless and they can't, make it. They don't have transportation. It just gets emotional at times, and all they're trying to do is get their children education and have them somewhere to play because they can't go outside or, little things like that. I think that everybody needs an equal chance, And my struggle, I've been trying to mask it. It was a struggle. I don't know how we would make it without our subsidy. I really don't. It just makes a difference. Having childcare and just being able to be comfortable.
So Delonda was selected to represent North Carolina at 0 to 3's National Strolling Thunder event, which unfortunately was canceled, of course, but I think it's pretty easy to see why. And I hope that just serves as a good example that, sharing your story doesn't have to be perfect. It just has to be personal. That's what makes it powerful. So I'm going to skip over this next slide and just quickly say that we have a ton of different tools and resources that you can use. So please check out our website. We've got advocacy toolkits, sign up for our action center. We've got sample social media posts, pretty much anything you can think of if you need help reaching out to policymakers, and we want to help you. So please use us as a resource in your efforts. So I hope that you are fired up, ready to go take action for babies today. I'm going to put a link in the chat right now for an action that you can take as soon as this is over. So wait 5 minutes or so. But legislators are still in session right now talking about COVID relief funding. They are planning to wrap up today. It's a very short session. So it is so important to call today. Tell them that babies need to be their top priority. There's not a lot of time left. The bill that they proposed does not do enough to support our babies and families. It doesn't provide an adequate response to the devastation that COVID-19 has caused. So please use the link. You'll find contact information, a script, talking points so that you can call right away. And then join us later today at 2 o'clock for a Twitter storm, a Think Babies NC Twitter storm. So I'm going to put a link in the chat here for sample messages, and I hope you'll join us there later. So I hope you'll stick around with us for another 5 or so minutes. So now it's my pleasure to ask Megan Bryant to join us for a very special story time to close this out. Megan is a Moms Rising member, a mother of 3, and a children's book author. And today she's going to read her brand new book, Citizen Baby, My Vote. I couldn't think of anything more appropriate for right now. So Megan, thank you so much for being here this morning.
Thank you so much for having me and for hosting this fantastic event. I have truly enjoyed every moment of it. And I'm so excited to share my newest book series, Citizen Baby. These books are very special to me because voting with my children and involving my children in the entire democratic process is so special and so important to me. So there are a lot of scenes in them that really feel pulled from our family life. And to make it an even more family-focused project, my husband is my co-author. We wrote them together. So we have Citizen Baby, My Congress, Citizen Baby, My President, and Citizen Baby, My Supreme Court, and Citizen Baby, My Vote, which I will be reading now. And our hope for these books is that they can help families find new ways to be involved in the process and help kids and parents really get engaged from an early age, because when kids see how important voting is, they are more likely to become voters when they grow up. So, My Vote. Citizen Baby knows a thing or two about voting. It's studying the issues is a great place to start. It's important to meet the candidates if you can. They love kissing babies. When there's a town hall, you have to show up, even if it's past your bedtime. Candidates need to hear your voice. Don't forget to register to vote. Then help your friends register too. Now it's time to get to work. The race is heating up and you're on a roll. Let's get out the vote. Phone calls to voters are almost as important as phone calls to grandma and grandpa. At last, election day is here. Don't let bad weather, long lines, or a busy schedule keep you away from the polls. It's your chance, your choice, your vote. Plus, you get a sticker. After voting, you have to wait for the results. Waiting is never easy, but win or lose, you can be proud of doing your part. Citizen Baby knows that every election matters and every vote counts. Now let's do it all again. The end.
Well, what a great day for babies. Let's be clear, though, it's going to take all of us working together to make sure that policymakers make babies their top priority. And we are not there yet. We have a long way to go. And there's no guarantee that any of these issues we've talked about today will actually make it to the finish line unless we push this agenda all the way there. We need every one of you Think Babies advocates across the state to make sure policymakers know that what we're talking about today must become their top priority. Don't forget to take action now. Make sure you check your email for the link to contact your legislator. We always have something up on our Take Action page, but please send your emails, make your calls, and join us at 2 o'clock for our Think Babies Twitter storm. Policymakers are here today in Raleigh. They'll be back again soon. This is just a special COVID session. So let's make sure when you call on them today or in the upcoming weeks and months that you believe it's time to think babies, and they should too. It's time to adopt policies built on the science of brain development. It's time to support budgets that put babies and families first. It's time to work for equity so that every child in every community, in every county in North Carolina has an equal opportunity to thrive, regardless of race, family income, or zip code. Babies can't wait. They're counting on us. Author Graham Greene once said, "There is always one moment in childhood when the door opens and lets the future in." We need to be those people who open the doors of opportunities for babies, and that door needs to open now. So that's why we Think Babies. We thank all of you for joining us today. I want to give a big shout out to Elaine and Angela, all the panel members, our DJ, Dr. Montez. It was great. And we hope you'll share these resources, and let's stay together and think babies. Thank you all for joining us and being a big voice for babies.